So let's talk about alopecia areata and a new treatment using platelet-rich plasma. If you're watching this, you probably already know what it is, you're suffering with it, or you're a physician who treats it. So I won't go into the details of the etiology, but it's thought to be an immune-type reaction against the hair follicle. So in this double-blinded, placebo-controlled study, it was done very well, published in the British Journal of Dermatology, a well-respected journal, in 2013. And what these investigators did is they compared the treatment of alopecia areata, and let's just look at a picture. This is what it looks like. Very unsightly, your hair's coming out. And what they did was they treated the scalp in the same person 3 different ways. One with placebo, the other with triamcinolone, which is the standard of care now, and the third area was with platelet-rich plasma. It's hard to blind the treatment person to which is the placebo, which is triamcinolone, because blood in a syringe looks different than saline or triamcinolone, and it feels different because it becomes more viscous when you add calcium, which these providers did. They added calcium gluconate. The other thing to know about this is platelet-rich plasma is all over the map with what people call platelet-rich plasma. Some use homemade crap, excuse my language, but homemade stuff from equipment that was made to analyze blood in the laboratory, not equipment that was approved by the FDA for preparing platelet-rich plasma for injection back into the body. And that is a huge thing. That is a very huge thing. So a lot of people who claim they're using platelet-rich plasma, they're not, or they're risking infection by doing it halfway. So it's important to know that part. Second, they did activate the plasma with calcium, which starts the thrombin cascade. The third, the platelet-rich plasma they were using achieved an average of 3 to 5 times the baseline value of what's in whole blood. We now know of over 20 different growth factors that are excreted from platelets that account for healing, and you're not getting those if you're not using really enhanced plasma, and you're also going to get a different spectrum, we know from multiple studies, if you're not using some form of activation. Now, it could be that it may work by just activating with the tissue that's with a collagen that's there. So platelets, when they're exposed to tissue, are activated, but we know we get a different spectrum. And in this study, at least, they chose to activate with calcium. So let's look at the results. This is a measurement of basically hair growth, the SALT score. And you can see this is placebo, this is triamcinolone, which gave a nice result, and this is platelet-rich plasma. This is just amazingly different. Burning and itching decreased significantly more with platelet-rich plasma. So this is a year out, this is 6 months, this is 2 months out. Most of the effects from platelet-rich plasma don't really start until the third to fourth week. So waiting 2 months is a safe time to wait to actually start to see the effects. And then it's better at 6 months and even better at a year. So let's just take a look at some of the important points. Here's the picture to show the difference. This frontal area was treated with triamcinolone. The occiput was treated. This was treated with platelet-rich plasma. Huge difference, huge difference. The other thing, some of the stats to notice about this paper, if you look on page, and you can download this, I'll give you the link in the description of the video, on 692, if you download this page and read this, you'll see a couple of things. 96% of the patients in the PRP group had regrowth of fully pigmented hair, so it came back the right color from the beginning of hair growth, where only 25% in the triamcinolone group had pigmented hair at the beginning of hair growth. That is huge. That is really huge. The other thing to notice, let's look down at this discussion right here. I want you to read this. So these comprehensive methods where patients served as their own control helped us to eliminate allocation bias. Okay. Nevertheless, should we notice that alopecia areata affects mainly young men and women. The age of the patients enrolled in this study relatively low. Additional, our study focused on the more chronic and relapsing form. We know that some alopecia areata just goes away on its own. These were the hard-to-treat cases that were not going away. So this is huge that we took the hard cases, or these investigators did, and got them better with platelet-rich plasma. So here they go over some of what we know. This is what we know. It really is. It's infuriating when people say we have no research to back up the Vampire Facelift and our associated procedures with hair and scarring. It's a huge amount of research out there. Over 10,000 papers with platelet-rich plasma with never, not one side effect ever. So here they refer to the more than 20 growth factors and some of the mechanisms and the other treatments for acne scarring, for wound healing, and hair growth. So that's it. I hope you find this helpful. And if you want to find someone who knows how to do this with the right thing, go to vampirefacelift.com, vampirefacelift.com. You can see more research there by clicking there and looking at how we're using it to rejuvenate the face, not just treat scarring, not just grow hair, but rejuvenate the face, as well as you can click here and go find a provider, multiple countries, multiple states, almost every major city. You can see some of the countries we have by clicking down on that drop-down menu. And then also, if you're a physician or nurse practitioner interested in joining our group and being kept up with the details of the protocols and the research, go to the For Physicians tab, and you'll be able to sign up for that. All right, this is Charles Runels, the inventor of the Vampire Facelift. I hope you found that helpful.